Dr. Ibrahim, welcome to Reboot with Dr. Arasi Maran. I'm so happy to have you here. You have to now tell us all about yourself, what got you into dermatology, and actually, you can also talk about how we met and where we met. So, brag about yourself.
Thank you for having me. My name's Omar Ibrahim, and I am a board certified dermatologist in Chicago, Illinois. I'm not going to spend too much time on my background, but I'm actually of Egyptian descent. I was born and raised in the Middle East, and I moved here when I was young, around 13, 14 years old. I've always known I wanted to be a physician. That's not a surprise being a Middle Eastern brown person. It is what it is. I ended up training. I did medical school at Yale, and then I did a dermatology residency at Cleveland Clinic, and then at Cleveland Clinic is where I did a lot of hair loss. We did plenty of hair loss. And then after that, I did a year of fellowship in cosmetic and laser surgery out in Boston. And then I moved back to the Midwest because I'm a Midwest boy, and I moved to Chicago. And I've been practicing in Chicago since 2017. And I do mostly aesthetics and hair loss. So I do all the Botox, the filler, the lasers. And on the medical side of everything, I do a lot of hair loss. And when I say medical, I don't do hair transplants. I do everything up until then when it comes with medications, at home treatments, in office treatments, and just everything diagnosis, evaluation, and treatment of hair loss I like to do. That's me in a
Fantastic.
nutshell.
I mean, that's quite quite a package to unpack there. I mean, that's an amazing pedigree, right? You went to Yale and
Thank
Cleveland
you.
Clinic. I mean, this is all
Thank
like the
you.
places, as a immigrant, like when I was in India, these are the places and names you want to be
Yep.
associated with. And, now why an MBA? We both met in the Kellogg Executive MBA Global Network Week. So why are
Yeah.
you pursuing your MBA?
That is the million-dollar question. And my accountant, my financial advisor keeps asking me why I'm going back to school and paying this tuition. But Dr. Arasi and we met at our global network week. It was just sort of like a reunion kind of thing for Kellogg Northwestern executive MBA students. So it's like a full-time MBA. It's a full MBA, but it's like it condensed into several weekends. So it like fits with our lifestyles and whatnot. But why am I getting the MBA? I am getting the MBA, and I joke around and I say I love what I do and I love my job. I love my patients. I wouldn't change what I have been through and what I have done and what I've accomplished for anything in the world. But I always joke around and say if becoming a dermatologist was a video game, I finished it. I finished the level, I finished the video game, and I feel like I'm on that same final level. I just needed a challenge. I need to expand my horizons, expand my career, whatever that entails. I do not know. Does that mean I'm leaving patient care? Absolutely not. I would die without my patients, but I just need something to spice things up and change things up. So we'll see how that goes.
You know what? I'm going to steal that because I have not been able to articulate why I'm doing
Yeah.
my MBA as well. But I like the being stuck in the same level of the video game. The video game is hard; it's breaking my
Yeah.
back, but I'm
Yep.
enjoying it. But I want more, so I'm going to take that from you.
It's the only way I knew how to explain it.
That's awesome. Okay, let's get into our topic. I want to talk
Yeah.
about hair loss today. I kind of feel like almost everybody at some phase of their lives suffer, struggle with hair loss.
Yeah.
We have two genders, so we have to talk about hair loss for each one of the species we have. So
Yeah.
just
hmm
let's talk about generally, like what are the most common causes of hair loss?
Got it. So, um, in terms of hair loss, and I do agree with you, almost everybody, and the stats show that up to 80-90% of men at some point in their life from the age of 0 to 90 will experience some form of hair loss or hair thinning, and up to 50%, so 1 in 2 women at some point in their lives will experience some form of hair loss. The two most common reasons why I see patients for hair loss, and they're the two most common types of hair loss in the country, if not the world, are androgenetic alopecia, which is has been renamed and rebranded as male pattern hair loss and female pattern hair loss. So that's the one, and we can get into it, but that's the more genetic one, hormonal one. And then the second most common one is telogen effluvium, and that is called TE for short. Telogen effluvium, it just means abnormal amount of hair shedding. We're supposed to shed 100, 150 hairs a day. When you go beyond that 200, 300, when you're noticing hair in the sink, on the floor, in your food, on the pillows, that's when it's abnormal. And that's telogen effluvium. And that is caused by a whole slew of things. If you Google causes of telogen effluvium, you can write a textbook. It's
Oh,
anywhere,
wow.
anything from vitamin deficiencies, iron deficiency, thyroid disorders, um, any prior surgeries, prior illnesses. We saw an oblivion of telogen effluvium after and usually, and what's interesting is that with telogen effluvium, usually after the insult, so it's even if they're planning a wedding, getting a divorce, taking exams, these are very, very common stressors, but 3 to 4 months later is usually when the shed happens. But what's interesting with COVID, you saw the shed happen within a couple of weeks.
Oh, wow.
And
Okay.
just a fun tidbit is that they thought it was just stress induced shedding from being sick with COVID, but they actually saw that the COVID virus actually infected the hair follicles. And so that's probably why it was causing such rapid hair shedding. But yeah, those are the two main ones: AGA, androgenetic alopecia for short, and TE, telogen effluvium.
Perfect. I mean, so let's start with the androgenic or the male pattern alopecia. So, when you
Yeah.
talk about male pattern, are you saying the typical central crown baldness and hair on the sides or the lower parts? Is that what you would say as male pattern alopecia?
Exactly. So male pattern hair thinning, usually there are different sort of patterns that it shows up in, but it's the classic one that you see in men. It is the crown thinning here. You can get temporal recession here. You can get thinning over here. And one of the myths is that people are like, well, I diagnose them, even if it's a 20 something year old, 30 something year old male, and you say, hey, you have AGA. They respond with, well, that's impossible because I don't see hair falling out. I don't see any hair
Mm.
shedding. Male pattern and female pattern hair loss are not caused, and I tell my patients this all the time, they're not caused by hair falling out and not regrowing. They are caused by hair follicles shrinking over time. When we call that hair follicle miniaturization, is you cannot even shed or have episodes of shedding. You could be totally normal and not have episodes of shedding, but still have male or female pattern balding. So it is caused by hair follicle shrinkage. And if you let it go too long, and some people have those cul-de-sacs and it's nice and shiny because the hair follicle shrinks to the point where it shrivels up and dies permanently. And so our treatment is to prevent and pause the process, but also to try to reverse that shrinkage. And there are ways that we can do that.
So, obviously your genes play a big role in this, right? So,
Yeah.
I've seen like teenagers or early 20s or late 20s
Yeah.
start having male pattern baldness. What can they do?
Yeah. So it is definitely genetic. So, and the whole myth of, it's from your maternal grandfather, that's where you get it. That's like the old wives' tale. But
Okay.
we still have not discovered the actual inheritance pattern of male pattern or female pattern hair thinning. The first thing that I do, and I've had a couple of like 15, 16-year-old males come in with significant alopecia. They had the scalps of 50, 60-year olds. That I would recommend at least a hormonal evaluation, look at testosterone levels, just make sure that there's no precocious puberty or anything like that going on.
Mm.
But in terms of, if you're first noticing it, the first step I say is Admit it, get a diagnosis. The first is admitting there's a problem. There are lots of people that
Okay.
are in denial. It is tough, especially if you're young. I'm speaking from personal experience. I remember sitting on the couch. My mom walked behind me and she said, "You're a hair loss expert and you're thinning in your crown." I ran to the bathroom and had a panic attack. And so I admitted there was a problem. So step one, and the reason that's important, and I say that facetiously, is admitting there's a problem because the earlier you treat, the better.
Okay.
And
Huh.
so, yeah, because if you wait too long, it reaches a point where it's not worth it because, like I mentioned, the hairs are completely shriveled up and gone. Or if you are 80% bald and we get 20% more hair, how much does that matter? And
Okay.
so always say start early. First and foremost, I always make sure that you're eating enough protein. You are getting your leafy green vegetables, your iron, take your vitamin D, make sure your nutrition is on point and it's nice and robust. My go-to treatments in men or male identifying patients, I should say, are one,
Okay.
minoxidil. If anybody that knows me, I, I prescribe thousands and thousands of minoxidil pills, and we can talk about pill versus liquid, but I prescribe minoxidil to almost every single one of my hair thinning or hair loss patients. Why? Because we don't really understand its mechanism yet, but it helps with hair growth. And then plus or minus finasteride. So finasteride is a testosterone blocker. It's a DHT blocker. It blocks the conversion of testosterone, which is in your body, it blocks the conversion of T to DHT, and DHT is what is thought to cause most of hair thinning in men. And so it is FDA approved at the 1 milligram dose for hair thinning. It does come with a slightly higher risk profile for sexual side effects and things like that. So you always want to counsel on that. I always do that. Make sure the patient's not already having those issues because you don't want to make anything worse. But I always start with, making sure your nutrition is on point. Consider minoxidil. Minoxidil is also the same as Rogaine, actually, 5% that's over the counter. And then consider finasteride. And of course, before you embark on any of these treatments, if you want to speak, and I recommend speaking to a board certified dermatologist to get on the right track, that's the way to go.
And you're asking them to take DHT blockers. You talked about
Yeah.
sexual side effects, but does it
Mhm.
affect muscle building in them, or does it cause muscle loss in them?
Great question. When we're talking young patients, like 20, like mid 20s onwards, I feel more comfortable giving them finasteride and talking about
Mhm.
finasteride. But just last week, I had a patient that I was seeing when he was 17. Now he's 18, 18 and a half, almost turning 19. I'm still a little leery of giving him any finasteride. We had the discussion. We said, let's discuss when next year when you're 20, because I mean, the body's still growing. The body's still growing and maturing when you're young like that. I'm more concerned about the sexual side effects because let's talk muscle. So with muscle changes, muscle growth, muscle loss, gynecomastia, like the growth
Mhm.
of breast tissue, that though all those side effects are extremely, extremely rare, almost non-existent at the 1 milligram dose, which is the FDA approved dose. So I have patients that do want to go up on the dose because sometimes it is helpful to a 2.5 milligram dose, 5 milligram dose, or even try dutasteride, which is stronger and it is slightly more effective than finasteride. It's off label. However, I always counsel once you go past that 1 milligram dose, the side effects possibilities of muscle loss, fat, gaining body fat in areas you don't want to, gynecomastia, these risks, and sexual side effects, of course, these risks increase with
Absolutely.
higher doses.
Okay. How
Yeah.
effective is minoxidil in regrowth of hair?
Great question. Minoxidil is extremely effective. And as monotherapy, and it really depends on the studies that you read, it is anywhere. So it up to 85% of patients are responsive to minoxidil. And this is topical minoxidil because there really haven't been much studies done on the oral minoxidil up until like the
Mhm.
last few years. But topical minoxidil up to 82% patients actually are responsive to it, and the ones that are not, some think that they don't have the enzyme that breaks down minoxidil in their scalp, and we don't have the ability to test for that, normally in clinic. But the studies show after consistent twice a day use, like you can get 40-45% regrowth. So that's why, like, if you're completely bald and you get 40% of your hair back, really does not make a difference. But if you see just mild thinning and we can go back, it makes a big deal. And funny story is minoxidil. There was a New York Times article, I think it was late 2021, that I've been prescribing oral minoxidil for years, since
Mhm.
2018, but it wasn't that big, that widely known. But in 2021, a New York Times article came out saying the new hair loss player on the block, something like that, low dose oral minoxidil. And of course, my patients were going crazy, calling, and they were like, I want to start this. And I tell them, you are already on it. Trust me. Like, go check your medicine cabinet. That either means you're not taking it or you just do what I say. So it is what it is. But, and there were shortages nationwide, is because minoxidil does work. It truly does
Yeah.
work.
So you said you've always been doing oral. So what is the advantage of
Great
oral
question.
versus over the topical?
So it there are some studies that show that oral is more effective than topical. And then as of last month, there was a study that compared 5% topical applied twice a day versus oral minoxidil, low dose oral minoxidil, compared them together. And this was one study last month that showed that they were equally as effective. But I dare you and I challenge you to find me one patient on this planet, I have not met them yet, that will apply topical 5% minoxidil twice a day for the rest of their lives. It's not going to happen. And so I've noticed that most of my most, gung ho patients, I see them at 6, 9 months and they're like, yes, I'm good with the topical. I see them a year later and they're like, yeah, I just fell off the wagon. It's tough. It's
Yeah,
tough.
it's tough. Yeah. So, what happens if you stop the minoxidil? Like, let's say you're a topical
Great
minoxidil
question.
user and you stop it. What happens to your
Yeah.
hair?
So if you're an oral minoxidil user or topical minoxidil user, when the thing that patients really get scared of, they're like, well, what happens if I stop it? Is everything going to fall out?
Mm.
That's the myth. That's not what happens. What happens is your hair slow. Let's say you reach a nice, plateau and your hair looks great. You stop the minoxidil. Within a few months, you'll notice that your hair starts to thin again. And I always liken it like going to the gym. If you go to the gym and you get all these muscles and you're eating well and you stop going, you'll notice that you start to deflate. That's exactly what happens to the hair. It's
That's a
just like
beautiful
brushing your
analogy.
teeth. If you want to keep the results, if you want to keep the muscles, you want to keep your teeth clean, you keep going to the gym, keep brushing your teeth, keep taking the minoxidil.
Do you ever get resistance to minoxidil? Like, how you get antibiotic resistance or something like
Mm.
that? Do you get resistance to the receptors on your scalp?
N- Not really resistance, but I do have non-responders. I do have
Okay.
non-responders, and as of yet, we don't know why people are not responding, because truly the pathophysiology as to why we call like male and female pattern hair loss happens is extremely complicated, and we are getting closer, but we have not truly discovered why it happens and which pathways are more important than others. And honestly, when you think about it, minoxidil is a very archaic. It
Mhm.
works. It's very archaic. And we've been
Yeah.
using it for decades, and we still don't even really understand why it works. It might have to do with blood flow. It might have to do with
Vasodilation.
exactly. So we're not really sure, but I have seen non-responders to minoxidil for
Mm.
sure.
Minoxidil, it was actually like a cardiac medication. We were using it for high blood pressure, and serendipitously, they noticed that these patients were growing hair. Does it make your hair grow everywhere? Like, are you going to have more facial hair? And, are you going to become like a grizzly bear because you're using
Good
it?
question. Good question. So my female patients, as thankfully the fact that I've been using this for years, I've figured out sort of the dosing that works. And so my female patients, that's the first question that they ask, but the dose that I use for female patients or female identifying patients and then male identifying patients is very different. The female identifying patients, the dose I have them on, the most sort of facial hair that most of them get, or any body hair, is maybe a little fuzzy here, a little peach fuzz
Okay.
here. No more than that. I had a couple of patients that even they were, I joke and I told them, I'm like, you are God's chosen one, because even at the baby dose, they grew hair everywhere. And I said, look at your scalp. So we can go to a much lower dose or even just do topical.
Okay.
But the male, and then the male dose, the males want thicker facial hair, thicker eyebrows. So they're happy.
Yes, yes.
They're, they're fine with it.
All right, enough about the men. Let's go to women now.
Yeah. Yes.
So, what are the most common causes of hair loss in women? Like,
Yes.
I feel like
In
in every phase of our hormonal lives, we have areas or vulnerable areas where there's hair growth and hair loss. I've had 3 kids, so I've enjoyed the pregnancy hair growth, and I
yeah.
hated the post pregnancy hair loss. So,
Yes.
let's just go through the entire female cycle.
Let's go, let's go through it. So I won't belabor the points, but the we've talked about androgenetic alopecia. The female pattern hair loss really is truly the same for both men and women. It's caused by hair follicle miniaturization, genetics, hormones. Still don't completely understand what is exactly causing it. The medications we use are a little bit different. I'd use oral minoxidil for sure, topical minoxidil, finasteride in postmenopausal women, just because women of childbearing age, especially if they're not practicing active birth control, it can affect the hormonal development of a baby. So I try to stay off
Sure.
of that. We use spironolactone a lot, which is also a blood pressure medication that's used in the heart failure ward, but we use it because it has anti-hormonal, anti-androgenic like effects that really does help with hair thinning and hair growth. And it helps reduce hair growth in women when they have like, facial hair growth, whether it's PCOS and whatnot. Telogen effluvium, that's TE. That's where you get a shedding oblivion of the hair.
Hmm.
Men don't and I'm not saying it necessarily affects women more, but women notice it more because women tend to have longer hair. They tend to style their hair more. And so if men have it, I know what to look for it. When I'm like washing my hair, I notice it in the sink and I'm like, well, I guess I'm shedding. But men don't notice. Women will notice because the hair gets clogged in the drain. It's on the pillows. It's more noticeable. So telogen effluvium can be caused, as I mentioned, by a whole slew of things. It's usually, and for most people, it's self-limited, meaning it stops within a few weeks and then the hair growth comes back. We used to think that, and this is why I get aggressive with treating telogen effluvium, because we used to think that, oh, all the hair comes back. You don't have to worry about it. But it turns out that's only a small minority of people. Most people
Hmm.
don't get all their hair back. So I get aggressive with treating the shedding, even though it's going to get better on its own. I tell patients the damage is done. It's like breaking a bone. I care about the recovery. So we need to
Okay.
recover the hair. So I'm treating for the recovery process to make sure that the hair doesn't get lazy and doesn't just tap out and give up and say, you know what, I'm 50. I don't need to come back anymore. No, it's like stimulate the hair growth as much as we can.
Do the PCOS and pregnancy.
Yeah, so PCOS we see in women is polycystic ovarian syndrome. Oh my God, I haven't like said it out loud in a while, but PCOS, where we get the overproduction or overstimulation of the androgens. These are like what we call the male hormones. Very, very high rates of androgenetic alopecia, especially in young
Mm.
women. So if I see a young woman with thinning and like in her 20s should not be thinning that much, especially with facial hair, like, chin hairs and hormonal acne, which is like cystic acne, usually in the beard area. That says hormones, hormones, hormones. You always want to check for PCOS. A lot of times you won't find PCOS, but we still call it androgen hypersensitivity. It's not PCOS by definition, but
Hmm.
your hormone receptors, at least in your skin and your scalp, are still behaving like they are going through PCOS. So I see a much higher risk of androgenetic alopecia or female pattern hair loss with PCOS.
So, how about obesity? I mean, PCOS, almost most obese teenagers or
Hmm.
most obese people, especially in the reproductive age group, end up with having some form of PCOS. Do you see an
Hmm.
association with the hair loss as well?
For sure, for sure. And especially because we know that excess fat and fat deposits do release, they're not, they don't just sit there. They are living endocrine sort of things in your body, cells in your body that do affect hormonal changes. But it also begs the question, chicken or the egg? Was the PCOS first and then the obesity and like, or are they associated? But I definitely do see at least an association.
During pregnancy, the hair growth is so luxurious. How can we
Yes.
preserve it post pregnancy? Or what
So,
happens post pregnancy?
so if you want to preserve it post-pregnancy, I think you would be fighting a battle against nature or God, whatever you want to call it. But I try to minimize it. So I saw like three patients today, and they said, you know what, I need to get off my minoxidil, I need to get off my spironolactone because I am planning pregnancy. I'm planning to start to try to conceive. And I tell them, you know what, as soon as you deliver, I've had patients like within 4 days of delivery either call me or see me just to get right back on the medications to blunt that shedding. So what happens in pregnancy? It's a myth that people think that, oh, your hair is growing beautifully and you get more hair. Actually, the hair is abnormal. So there are different phases of the hair growth cycle. There's the anages, the growth phase, telogen, which is the catagen, sorry, which is the resting phase. Then telogen is the shedding phase.
Shit.
So in pregnancy, the anagen phase is abnormally long. So the hairs that are supposed to be recycling and shedding are sticking in the scalp, sticking by much longer. And so all that hair that you have, you shouldn't really have. Does that make sense? It's because it should have shed. But but people, when the shedding starts, sometimes it takes a lot more hairs than it should with it. And that's why people thin after pregnancy. And then some of them never recover and never bounce back. So the same treatments we discussed, you can also use for hair, postpartum, um, postpartum shedding.
So, is this a myth or the truth? One of the reasons I thought, I mean, now obviously you have a great scientific explanation for it, but I thought,
Mhm.
like, most of us, when we are pregnant or trying to get pregnant, we start taking biotin and iron supplementation. And one
Yeah.
of the thoughts was, oh, maybe my iron levels are improving and my biotin levels are improving. And I see a lot of advertisements for biotin supplementation and saying that causes
Yes.
hair growth.
Yeah.
True myth or truth?
Mostly myth. Mostly myth, especially because biotin has been proven to be on its own essentially useless for hair. And so
Hmm.
biotin deficiency causes an extremely severe type of hair thinning and hair loss, and we study about it in residency, but there isn't a single human being in the US that is affected by biotin deficiency because of we are a first world country and we have the resources and our dietary supplementations. It's almost impossible to get a biotin deficiency unless you have some sort of hereditary disorder. But biotin on its own has been proven pretty useless. Iron, I have a lot of patients that take prenatals. Those in and of itself are not alone, not strong enough or powerful enough to give you that pregnancy luscious mane.
Dang it, man. Why couldn't you dermatologists figure out a way?
We're trying. We're trying.
But honestly, the post pregnancy hair loss is brutal. I'm like,
It
what is this?
is.
Am I like a chemotherapy patient? It's like locks
It
of
is.
hair. Just it's pretty traumatizing. I have to
It,
say.
it tr- it it really is. It really is, and it makes patients. And I feel for my patients because it makes patients not want to touch their hair or even wash it, and they don't want to look in the mirror, and they don't even want to look at their brush, or they don't want to brush because it just re-traumatizes them.
Mm.
But it is totally normal. But it's good to seek treatment if it's excessive and if it's extending past a few weeks, and try to seek treatment to try to stop it sooner and get that hair growth back as much as you can.
See, I mean, the hypothyroidism also causes hair loss, right? So,
Hmm.
how is a patient going to, not going to call them a patient. Like, how is a person going to say, I'm shedding hair, I should go see a doctor,
Yeah,
versus I'm going to try over the counter Rogaine or something like that? How do they look in the
great.
mirror and say, it's time to go see a doctor?
Great question. So the telogen phase, where you're starting to notice shedding, and when we're just referring to telogen effluvium. So theoretically, according to most data, is that the telogen effluvium phase should last just a few weeks. And so we say it should last anywhere, I don't know, between the three, I mean, like they say like 3 to 6 weeks. But
Mm,
if it's going 3 months, and there are things called chronic telogen effluvium where it goes past 6 months. And so if it goes like months and months, then definitely go see a doctor. A lot of times we actually don't find any abnormalities in the blood, but that doesn't mean you can't treat it. And so we still
okay.
treat it and it's still helpful.
All right. So now I'm going to kind of talk to you, ask you, faggot male female pattern, general advertised products, right? I see a
Yeah.
lot of potions like, oh, I'm going to just go ahead and say the
Yeah.
brand name, like Vegamore. Use
Yeah.
Vegamore. It comes with shampoos, it comes with lotions, and,
Yeah.
is there any evidence to what is in them? Because I've tried to look at the ingredient list of Vegamore and I truly can't find anything which can cause hair growth.
Yes, and so Vegamore and a lot of not specific with Vegamore, but a lot of them do have proprietary blends of things, and so it's sort of under, seal.
Trade secret.
But exactly. So out of my personal experience of what I learned from Vegamore, I've had a few patients that actually did very well with Vegamore that were very intolerant of minoxidil, whether it was the alcohol in the oral or in the topical, didn't want to do oral and had very sensitive scalps. Vegamore actually helped with a little bit of hair growth because a lot of those botanicals, a lot of those plant-based extracts, esoterically and anecdotally, they sometimes do help with hair growth. And
Mm,
again, we have no idea why. Like there was just an article that I helped write for Botana oil for which I had never
mhm.
heard of. And I helped give commentary. I did some research. I was like, yeah, maybe Botana oil does help with hair growth. But you have to keep in mind, these are very weak studies and as far as I'm concerned, they have not been compared to gold standard treatments, which are
Okay.
minoxidil, finasteride, spironolactone. But for
Mm,
starters, and especially if you can't get to a dermatologist, or if you just don't want to do prescription medications, you want to keep, a natural treatment, keep it plant-based. There is some evidence with Vegamore, at least in my experience, I've seen it help, but does it replace the gold standards? Absolutely not.
okay. Now, how about rosemary oil? I mean, that was a good
Yep.
study in a good journal, right? What
Yes.
about rosemary oil?
So rosemary oil was shown to be helpful, but that study was comparing it to 2% minoxidil applied twice a
Ah.
day, and nobody really uses 2% anymore. 2% was the female version of the 5%, and I don't know if they still make 2% because now it's 5% men's and there's 5% women. So we never really prescribe the 2% anymore. At least I don't.
So again, then there came a whole slew of products, right? Rosemary oil conditioners and shampoos.
Yes,
And then I'm like, who is going to put rosemary oil twice a day, every day for 6 to 8
exactly.
months? Like, how is that even
Yeah.
possible?
And
Nothing.
I
That's
think
another myth.
honestly, it's no, no, no. It works. It's another myth that someone's actually going to do it. But the rosemary oil, it was shown to be non-inferior to the minoxidil 2% applied twice a
Minoxidil.
day.
Okay.
But the issue is like God bless social media. I would not have a career without social media and pop culture. I get it. But the issue is like social media and these TikTok sleuths, they find these articles from the 80s and the 90s, reprise them. And I get questions and we're like, what do you think about rosemary oil? What do you think about cinnamon oil? What do you think about this? What do you think? I'm like, where are you? And I'm like, oh, this was like published in the 90s. And then because it's natural, because it's something that's accessible, because it's not a medication or a prescription, it
Mm.
tends to really like, and it's great branding. So people jump on that. And there you get the shampoos, you get the solutions, the conditioners. It tends to speak to people's These are great, if you will, value propositions. It's natural, it's accessible, it's medication free. So people tend to resonate with that, which I totally understand.
And how about, now I see a whole bunch of laser combs or
Yep.
red light therapy
Hmm.
hats and stuff like that. Do they have a
Yep.
role in hair loss?
I almost never prescribe them because I'm very aggressive with treating hair thinning and hair loss because it's safe, of course, as long as the patient's okay with it. But when it comes to the red light therapies or the low level laser therapies, whether they're done in the office or whether they're done at home, they have been shown to be helpful. But the issue is a lot of these devices out there are not created equal. And so you don't know what do you need, like 16 bulbs or 32 bulbs or 64 bulbs. But regardless of the device itself, the studies have shown that it does increase mitochondrial activity, but you have to use it exactly as recommended for at least 1 to 2 years to see benefit. Again,
Oh, wow.
who is going to do that?
It's
Not
I think
me.
it comes down to consistency. All of them,
Yeah,
all of these
it really
products.
does. It really does. But with and I should say with the medications, and we'll talk about injections like PRP and exosomes, you can
Hmm.
see results as quick as soon as like 4 months. And
Okay.
so the red light lasers, there is some evidence that they do help, but you have to use them exactly as prescribed for a long period of time. And that means going on vacation and taking the device with you. And so these are things to consider.
Yeah, it's a big commitment. It's a way bigger commitment
Exactly.
than, so now let's segue straight into injectable treatments, plasma-rich platelets,
Yes.
exosomes. What
Yeah.
are the spectrum? What is in the spectrum of these injectables?
So I'm just gonna, with the caveat, I'm not giving any recommendations because
Yes.
these are not FDA approved treatments. Hopefully we're getting there, but these are growth factor based treatments. So let's start with PRP, platelet rich plasma, really took off. It's been around in Europe and in Asia, and it really took off years ago in the orthopedic literature. So they are and still do inject it in joints, helps with joint inflammation, but also helps with building, the structures needed to lubricate the joints. However, they moved to the dermatological side in like skincare and in like microneedling and things like that. But we started to use it for hair quite a bit starting in 2016, 2017. It's a procedure where they draw your blood, spin the blood down in the lab, and then everything's done the same day. They draw up the top part of the blood, which is the platelet rich plasma, and the red part, because it separates into like this, what we call liquid gold, and then dark red stuff. You discard the dark red, you take the gold, inject it in the scalp, off label. Just gonna say that, but you can, and most people do microneedle it into the skin.
Hmm.
However, the studies are all over the place. They're all conflicting. Some studies have shown improvement, some studies have not. But the issue is the patient, like, were the patients on, did they have like chronic kidney disease? Those patients have platelet dysfunction. Were they on NSAIDs? How old were they? Did they really have androgenetic alopecia? And how did you prepare the PRP? Because each PRP system is different. So there's double
Hmm.
spin systems, there's single spin systems. I'm not going to even go into all of that, but there's
Yes.
a lot of there are a lot of confounding and move and changing factors that made PRP, especially in my practice, very inconsistent. So I had some patients that responded very well, some patients that didn't respond that well, and it's tough and it's hard to tell why because of all those differing like patient characteristics, including like within like a patient was like, oh yeah, I did PRP a couple times and I loved it. Now I don't see any results. Maybe their platelets changed. Maybe they were dehydrated the day of. So who knows? Who knows? But
Yeah.
it is fairly safe, not FDA approved, but hopefully we're getting closer to that.
Okay. And how about this auricular node biopsy? Or,
Yeah.
I mean, I won't say biopsy. They take the node and again do some magic with it and inject it. What is it? The same growth
So I think
factor?
exactly. So I think you're referring to exosomes because there are people that,
Okay.
um, they're like the auricular node, and then there's the skin biopsy ones. There's one that you take the skin biopsy, and then do something with it, and you send it to the lab actually, and then they
Oh,
prepare it
okay.
for you. And what exosomes are, they're little packets that contain growth factors. They're growth factors that are the same sort of growth factors that are found in PRP, but exosomes technically are more concentrated, they're stronger. Again, many more studies are needed to corroborate these claims. You can use your own exosomes, but there are several companies that use exosomes, and it sounds like the Hunger Games here, but they have a group of 18 to 24-year-old very healthy young individuals that are screened for all kinds of diseases, of course. They donate their bone marrow. So they donate bone marrow stem cells, and these bone marrow stem cells are stripped of all cellular material, including DNA and whatnot. The exosomes are then, which are just the proteins, the growth factors, are then multiplied in the lab, of course, sterilized and all that good stuff, and packaged in little bottles like we do Botox. And then you can microneedle that into the skin. These are not FDA approved for injection, but they are. But I have seen and I have heard of people injecting them in the scalp with extremely good results. But they
Mm.
are, you are cleared or at least okay to use topically. I've used them after laser treatments. They really help with healing and building collagen and whatnot, but they have very, very good promise, much more than PRP in the treatment and regrowth of hair.
Oh, wow. Okay. I mean, it's kind
Yeah.
of a little bit extreme to use a bone marrow stuff
I
for
mean,
hair
I will be very honest. I'm not saying I do inject the exosomes, but when I mention it to my patients, they're like, "You don't have to take my blood. It's more consistent. It's less painful. Sign me up."
Mm.
It is.
Oh,
I mean,
gosh.
it is, and they pay the
Of course, it's a
volunteers very well.
hefty,
They pay.
yes, I'm sure it's, but nevertheless, shouldn't we use it instead for leukemia patients and all of that?
Talk to your government. Okay.
Oh, I can have a long conversation. I don't know if the conversation will go anywhere, but we can discuss it.
I love
So I
it.
think at the creme of all of this is hair transplantation. If all of
Yes.
this fails, or how would you define failure, or
Yeah.
when do you say how does it how when do you
Yeah.
say okay, it's time to go see a hair transplant
Yeah.
person, physician?
So the old thinking used to be either get a hair transplant or do the medical. It's no longer, you cannot think of them as mutually exclusive, and you cannot think of them as you cannot. And I have still have patients that are just like, oh, this is just this is buying time, and then you do the hair transplant and it's a cure and you're done. Absolutely not. I have seen patients get hair transplants and not get on medication, and then they continue to thin, and then they have tufts of hair where the hair was transplanted, and they're bald everywhere else, and now they have to shave every single day. And so I tell patients you have to be and should be on these medications because you're not going to transplant your entire scalp. You have to be on some sort of maintenance treatment because it not only helps the transplanted hair survive, because not all of them take, but also it helps maintain the hair around it so that you don't have thinning elsewhere where around where the transplanted hairs are. And so if a patient is far gone. Like, I don't know. If I would say, because they're different scales, if they are 70, 80% or more in terms of hair thinning and hair loss, men or women, I ask them how much it bothers them. I give them all their options. Of course, I tell them I'm very realistic, and I tell them, the best we can get is like 40, 50% regrowth, but let's hope and pray for more. And lots of my patients, if not most of them, when we get the regrowth back and they're like, yeah, it looks less severe, they actually opt out of hair transplant. However, if
Okay.
they continue, so I tell patients my algorithm is let's treat you for at least a year. We get on a cruise control regimen. I usually start treatment, see them 6 months later, see how they're doing, see them in another 6 months, and then assess how they are feeling and how they are looking. I was trained in doing hair transplants. I don't do them because they are awfully tedious and I don't have the patience, so I don't like to do them. But when you look at the scalp, and if you see there's enough hair and enough space between each hair follicle, then you can send them for hair transplantation. And then the hair transplant physician or provider will be able to tell, are they a good candidate? How many do they need? XYZ. I always caution and always look at reviews and ask about who's actually doing the transplant. who's getting the grafts, what kind of, is it FUE, which is follicular unit extraction, or is it the strip back there? Those are different. They're not, it's not necessarily one's better than the other, but you have to be a
Hmm.
good candidate for either one. A lot of these places are like assembly lines, and you don't see the physician ever, and they just give you a cookie cutter method. You have to do your research, go read your reviews, talk to other patients if you can, make sure that you're getting the treatment that is right and customized for you.
Thanks to social media, I've seen these reels about how a whole bunch of Americans are traveling to Turkey for
Turkey,
whatever
yeah.
reason has become the transplant hair transplant destination. What is the
Yes.
deal there?
It is very cheap. I think with like $2,000. I had a patient tell me this, and I didn't believe it, but with I think it was two. I will say $3,000. I will overextend it. $3,000 included the flight, the hotel, the surgery, and a round trip, and a nurse checking in on you post surgery in your hotel room. That's why
Hmm.
people are going to Turkey. And
Okay.
I've seen some amazing work come out of Turkey. However, there are a lot of quacks and a lot of uncontrolled posts that are coming out of not just Turkey, all over the world. So you have to make sure that you are doing the right research if that is where you want to go. But what I say is, God forbid if you get an infection, you get some sort of
Yes.
complication, you are alone once you come back to the US,
Yes.
because
Yes.
a lot of physicians will be afraid to treat. They don't know what happened. They don't want the liability. Of course, I would treat, of course, but if it was out of my wheelhouse, I would not know what to do. But just know that it's not just about the care that you're getting in that moment. It's your pre-care, and most importantly, it's your post-care.
Post care. All right. Fine.
Yeah,
Oh, Omar, this has been such a fabulous conversation. I've
it's been
enjoyed
great.
myself. Yes. So now I'm going to ask you some kind of sort of rapid fire questions. Okay. And
Love
you can
it.
obviously choose to
About hair or in general?
about hair. Okay.
Okay,
And
love that. I love that.
so, what is the one hair loss treatment you think is underrated?
Minoxidil.
Hmm.
Truly, minoxidil. I call it, sorry, rapid fire, but I call it anti-aging for the hair. That's what I do.
Huh. Interesting. I like it. I like
Yeah.
it. Now, what is the one best hair care tip you swear by or you follow on a regular basis?
Hair care. Um, Wash your hair. I see a lot of people are afraid of overwashing their hair. Trust me, it's almost impossible. Wash your hair a little more frequently. There's a lot of oil and scale and hair and like inflammation because people just don't wash enough. So my hair care tip is wash at least every other day, if not
Okay.
2 to 3. I would say, especially I get it in African American or black hair, at least once a week. I know it's tough if you can, but wash more than you think.
Okay. All right. Wash your hair, people. All right. There are so many expensive hair care products, and
Hmm?
so many expensive heating tools. And what is the effect of those pulling and stretching and curling on the hair? Can that traction lead to
Hmm.
alopecia or hair loss? It's
Absolutely. I
more than a
see it
rapid
all.
fire right there.
And no, absolutely. I see that a lot. Traction alopecia in more commonly in cultures and races where there are more tension in terms of their hair care practices. However, recently I've been seeing it even in Caucasian white patients because there's a lot of pulling and a lot of overheating. And now more and more people are using sew-ins and wigs, and it's not just culture specific. So I've seen a lot of traction alopecia. So definitely don't overdo the heat, don't overdo the pulling, don't even overdo the straightening.
Okay. And this we did not talk about hair straightening, the Japanese thermal straightening and the keratin
Yeah.
straightening, the hair Botox. What is the effect of all of that on hair loss?
Yes. Um, as a dermatologist, we hate over straightening. So whether it's chemical straightening, whether it's the Brazilian blowouts, whether it's a keratin treatment, we say try. I know it's not sustainable to say, you know what, just go natural. That's what we learned to say in residency, and I think that's culturally insensitive. We say at least try to space it out as long and as much as you can, because we didn't get into it. There is a condition called CCCA, which is a condition that it's an autoimmune hair loss condition that's almost exclusively found in Black women and African women of African descent. And it used to be called hot comb or relaxer alopecia. It's no longer called that because it's genetic and that's been discovered. However, over straightening using caustic chemicals can actually make these inflammatory hair losses worse and can lead to scarring. So I say you don't have to, give it up completely. Try to space it out as long as you can. Like maybe not go every 6 weeks, maybe try to do it every 12 if you can.
Okay. All right. Now, is there, again, coming back to the hair care product market, you have
Yes.
shampoos and conditioners, which are like, almost $200, $300 to
Yeah.
a $6 shampoo. Is there a
Yeah.
difference in these thing? Is there one company which is better than the other, or it's all the same? And we're just spending way too much money.
It's amen. That's the latter. There is a reason hair loss and hair thinning. It's a billion dollar industry. Is unfortunately there are people that get taken advantage of, and there are these you are paying for the cosmetic feel, the name, the reputation, but you're not necessarily paying for results. So you do not have to. I mean, patients look at me crazy when they say, "What is one of your favorite shampoos?" And I say Head and Shoulders. Like zinc in Head and Shoulders has been shown to help with hair growth. It's anti-inflammatory, and they have all kinds of flavors nowadays. Pick yours favorite one. I love Head and Shoulders.
Okay. Um, I forgot my question. You made me
Sorry.
laugh. Okay, fine. So don't spend on expensive shampoos, etc.
No.
But how about
Mm-mm.
these so-called treatment shots or oils? Like,
Yeah.
does that the Olaplex blending or bonding thing?
Yes. Yeah.
Is it does it do anything?
Though not so much the oils and the conditioning treatments and things like that, they don't help with hair growth at all, but they do, but some of them do really help. And depending on like the marula oil, whatever ingredient, some of them have like the shea butter. They really do help with hair quality, hair shine, hair strength, and frizziness and making sure things are under control. But with hair growth itself, they don't do anything.
That okay. I used to. I'm a low maintenance person, and of course,
Mhm.
aging does not go with low maintenance. So it's
Yeah.
annoying me that once my the hairstylist said, clearly you don't put products on your hair. I'm like, yeah, 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 I don't put products. And then she said, you put lotion on your body? I said, yeah, of course. Then she was like, your hair also needs lotion, so you need to put.
Absolutely.
I was like, oh, okay. I did not
I
think of it
like
like that.
I like that. I like that. I'm going to use that. I'm going to use that.
Okay, a low maintenance person like me, if there's one thing I could do to improve my scalp health or hair health, apart from
Mm.
washing, don't tell me wash your
Yes,
hair.
yes, yes.
What could I do?
To your scalp health and your hair health, apart
Yeah,
from washing. Interesting. Okay. Um, Honestly, it might sound cliche, but I mean, it really, really starts with good habits. And honestly, it is making sure that and if you, especially, this comes before talking about minoxidil, this comes before all these medications and treatments. It starts with healthy habits. Eat your leafy green vegetables. Make sure that your iron is up to date. Protein has been shown to be extremely important. You need at least 60 to 80 grams a day for the hair. Vitamin D has been shown to be extremely important. A lot of cases, especially telogen effluvium, have been, at least in my experience and in the studies, have been shown to help to at least partially be caused by some aberration or some deficiency in what I just mentioned. But so it really, as cheesy as it sounds, it really starts with a good, healthy diet and good habits like the washing and the conditioning. It starts there.
well, one last question. we are in the era of GLP-1 agonists everywhere, rapid weight loss for whatever reason.
Hmm.
Are you
Yeah.
seeing patients with rapid weight
Hmm.
loss and hair loss? I mean, apart,
Yep.
what is the solution for them?
I just saw one today, and she lost 20 pounds over the last 3 to 4 months, and now she's shedding like crazy. And so I recommended to up her vitamin D. I recommended to make sure that we check her iron. I also made sure that she was upping her protein. There are a couple of hair supplements out there that have like selenium and copper, and they have like biotin and vitamin D. They're out there, and I'm sure you've seen them on Instagram, and they actually give you the nutrition that you need. So we started there. And we also discussed if it doesn't improve over the next few weeks, then we're going to add in some oral minoxidil, because oral minoxidil, more so than topical, has been shown to help with telogen effluvium. And we even talked about maybe PRP exosomes, like microneedling it into the scalp if it doesn't improve. But right now, I told her just minimize stress. We didn't talk about it, but ashwagandha is great for stress-induced hair loss. It's a plant-based
Mm,
anti-stress. And make sure the protein, make sure the nutrition is robust.
fantastic. Omar, thank you so much. This was a fun conversation. You
My
did make me
pleasure.
lose my train of thought. We had a
Sorry.
great time.
This was a
But
blast.
this is awesome. Yes, thank you so much. I appreciate it.
Thank you
We
for
have to come
having
back
me.
for skincare another time.
I'm down. I'm down. All
Thank
right.
you.
Take care. Bye bye.
Thank you so much for listening. If you found us valuable, you can subscribe to the show on Apple Podcasts, Spotify, or any of your favorite podcast app. And also, please consider leaving us a rating or a review, as that helps others find the podcast too. I hope you have a great week ahead.